The topic is dentinal hypersensitivity. Definition: it is defined as the pain arising from exposed dentine, typically in response to thermal, chemical, tactile, or osmotic stimuli. Here, pathogenesis of dental hypersensitivity. Etiology: the main etiology is loss of enamel and loss of cementum. Loss of enamel is due to attrition, erosion, abrasion, effraction, and faulty toothbrushing. Loss of cementum is due to periodontal disease and gingival recession. Iatrogenic causes are there due to restorative procedures and bleaching. Medical conditions, mainly bulimia nervosa, GERD, salivary hypofunction, chronic alcoholism, and asthma. The pathogenesis of dental hypersensitivity, it is developed in two phases. Lesion localization. It is due to dentine when it is exposed either because of loss of enamel or gingival recession. The lesion initiation, the dentinal tubules must be open to both oral cavity or the pulp. Mechanism of dental hypersensitivity, it is mainly three mechanism or three theories are there. First one is direct innervation theory, odontoreceptor theory, and fluid movement or hydrodynamic theory. Direct innervation theory or conduction theory, this states that nerve endings within the dentinal tubules which have direct communication with pulp nerve fibers and directly stimulated, which results in dental hypersensitivity. Second theory is odontoblast receptor theory or transduction theory. Based on this theory, odontoblasts act as the receptors of pain and transmit the signals to the pulpal nerves. Third one is fluid movement or hydrodynamic theory. It is put forward by Brandstrom in 1964. And based on this theory, dental hypersensitivity is made as a result of movement of fluid inside the dentinal tubules, which is further due to thermal and physical changes or as the result of formation of osmotic stimuli near the exposed dentine. Movement of fluid stimulates the baroreceptor and leads to neural discharge, and the process is called as hydrodynamic theory of pain. Diagnosis of dental hypersensitivity. It can be assessed by two methods, response-based method and stimulus-based methods. Based on response-based methods, first one is visual analog scale. And in this procedure, adjacent tooth are isolated using the examiner's fingers, and a stream of air with a pressure of 60 plus or minus 5 psi and a temperature of 21 plus or minus 1 degree Celsius is directed perpendicularly to the tooth under examination from a distance of 1 centimeter for a duration of 1 second. And this is the shift scale of sensitivity. 0, the patient displays no response to the air stimulus. 1, the patient reacts to the air stimulus without requesting it to cease. 2, the patient reacts to the air stimulus and either requests it to stop or move away from it. 3, the patient responds to the air stimulus, deeming it painful and asks for to stop. Stimulus-based methods, mainly various stimuli are there. Mechanical stimuli method, chemical stimuli method, electrical stimulation, evaporative stimulation, and thermal stimulation. Mechanical or tactile stimuli, mainly it is done by using an explorer or a sharp explorer or a probe. And the grade of the response is 0 to 3, 0 no pain, 1 slight pain, 2 severe pain, and 3 severe pain that last. And scratchometer, it is a handheld scratch device, and the torsion gauge is there. We can use sharp explorer like probe that, and we probe that CEG. The mechanical pressure stimulator uses a thermistor probe to allow flow of current to that area and record the finding. It consists of a 15 millimeter stainless steel wire with a fine point and capable of producing across the buccal surface of the sensitive tooth, and probing involves moving the wire across the exposed root surface, increasing the scratching force measured in millimeter until a pain response is elicited. Evaporative stimuli. In this method, directing a burst of warm temperature air from a dental syringe onto the test tooth. Once one of the second blast from the air syringe, the temperature is between 650 to 700 Fahrenheit and a pressure of 60 psi. And the scale mainly consists of 0, no discomfort, 1, mild discomfort with no severe pain, 2, severe pain when stimulus is applied, 3, severe pain occurs and persists even after removal of stimulus. Temporonic device, it is a microprocessor temperature controlled air delivery system. Here the air temperature can be varied in the range of minus 5 degrees Celsius to plus 85 degrees Celsius. Airflow is regulated at constant rate of 60 psi. Thermal stimuli. it is a thermoelectric device. It provides a continuous application of heat or cold, consists of small probe tip to which thermistor is attached, and this thermistor measures the temperature at the probe tip. A current flow is used to regulation of air temperature either by increasing or decreasing the current flow in a range of 12 degrees Celsius to 82 degrees Celsius. And it is preset at temperature of 37.5 degrees Celsius. It can be used for heat and cold testing by increasing or decreasing the temperature by 1 degree Celsius. Cold water testing, it varied the temperature of 15 ml of water is rinsed. The various agents used are ice stick, hot or cold air, or ethyl chloride. Electrical stimulation. In this method, electric pulp tester is used. It is a battery operator producing pulses of direct current. The intensity of the output voltage may be increased by presetting various numbered gradations on a thumb wheel. Management of dental hypersensitivity, mainly therapeutic approaches, mainly includes at-home techniques and in-office technique. And these two techniques mainly results in impeding the nerve impulse transmission or blocking the dentinal tubules. And the management at home mainly currently involves the use of the following methods: desensitizing toothpaste, desensitizing mouthwashes, herbal agents in dentifrices, and mouth rinses. First one, dentifrices, desensitizing dentifrices, which contains potassium salts such as potassium chloride, potassium citrate, and potassium nitrate can be used at home technique. The potassium salts, the main action is it penetrates into the dentinal tubules, numbs the nerve fibers, and diminish the tooth sensitivity. And the dentifrices which contains sodium fluoride. It is one of the common fluoride compound in toothpaste. And the fluoride helps to deposit minerals such as calcium and phosphate onto the dentinal surface, which can help strengthen and harden it. When the fluoride ions come in contact with the tooth surfaces, they can block the exposed dentinal tubules. And the next fluoride content we are using in desensitizing toothpaste is stannous fluoride. And it shows a remarkable effectiveness in sealing the dentinal tubules, which can attribute it to strong attraction of stannous ions to the mineral surface of tooth hard tissues. And it creates a protective layer on the tooth surface by establishing bonds with exposed tissues. And dentifrices, which contains bioactive glasses, that is effectively occlude or block the dentinal tubules. When applied to the tooth surface, bioactive glass particles can penetrate the tubules and form a physical barrier within them, as well as attract tooth structural ions, mainly calcium and phosphate, and promote the formation of hydroxyapatite crystals. And the dentifrices, which contains casein phosphopeptide amorphous calcium phosphate, and it is a recently introduced dentin remineralizing agent derived from milk proteins and is known as Recaldent. And this product incorporates phosphopeptides and plays a role in retaining and stabilizing amorphous calcium phosphate. The process possesses the capability to remineralize the initial subsurface enamel lesions. And dentifrices which contain strontium chloride. Usually the concentration of 10% of strontium chloride in a manner that reminiscent of calcium within the human body. This active element stimulates the dentinogenesis in human dental pulp stem cells. This stimulation, as it has been demonstrated in previous in vitro studies, may foster their proliferation, differentiation, and mineralization, leading to the formation of tertiary dentine. And at-home technique, desensitizing mouthwashes can also be used, which contains potassium nitrate, cetylpyridinium chloride, sodium fluoride, aluminum lactate, arginine, and potassium oxalate. Mainly the mechanism is nerve desensitization, protein precipitation, and tubule occlusion. Next method of management is in-office therapeutic treatments of dental hypersensitivity. And the agents employed within the dental practice for dental hypersensitivity treatment are categorized mainly based on their mode of action. Two groups are there, those techniques that hinder the nerve impulses transmission and those techniques that occlude the dentinal tubules. So therapeutic agents that hinder the transmission of nerve impulses, mainly we can use potassium salts, and also the other method is low-level laser therapies. Potassium salt gels can be used. When these salts are applied to the exposed dentine, they increase the concentration of potassium ions in the tubules and surrounding tissues, influencing the normal depolarization and repolarization process of nerve cells. And the other method is low-level laser therapy. and it's also known as cold laser therapy or photobiomodulation therapy, and has been explored as a potential treatment for dental hypersensitivity. And this low-level laser therapy can engage within the dental pulp, resulting in increased odontoblastic activity, which leads to the production of tertiary dentin and reduction in the lumen size of dentinal tubules. Such lasers can also induce cell activity, trigger anti-inflammatory responses, and generate analgesic effects. And next method is fluoride antiphoresis. This process of influencing ionic motion by electrical current and has been termed antiphoresis, electrophoresis, or cataphoresis. This method of antiphoresis was first described by Tivati in 1747. And various other in-office technique like adhesive agents can be used when combined with resin composites. It creates an occlusion of the dentinal tubules, yielding a hybrid zone. Newer bonding agents alter the smear layer and integrate into the hybrid zone. And oxalate salts can also be used. The application of 28% of potassium oxalate can facilitate the formation of calcium oxalate within the dentinal tubules. And for enhanced efficacy, dentine etching can be employed in conjunction with this oxalates. Alternate treatment regimens, mainly traditional methods are there, restorative methods are there, and surgical approaches. Traditional methods, Chinese traditional medicines, which are becoming more and more popular in the Western world, particularly when treatment fails by orthodox methods. And it has been treated successfully by brushing the teeth with a mixture of root dahurian, analgelica, the root of Chinese wild ginger, puncture vine, peppermint, and gallnut. Restorative methods, mainly the composite resins, class 5 composite inlays can be used. Gingiva colored composites may be better option for treating the root lesions that extend up to the dentinal enamel junction with no coronal cavitation. Cyanoacrylate can be used. It has been proved to be the treatment capable of reducing dental hypersensitivity. Cyanoacrylate acts by obliterating the dentinal tubule entrances. Consequently, there is no fluid movement and pain level reduces also. Surgical approaches for management of dental hypersensitivity is mainly by the root coverage procedures. And these are the root coverage procedures: free gingival autograft, free connective tissue autograft, pedicle autograft, laterally positioned flap, coronally positioned flap, including semilunar flap, subepithelial connective tissue graft, guided tissue regeneration, pouch and tunnel technique. So the to conclude, dental hypersensitivity is a widespread oral problem which affects the people in all the age group. When a patient visits a dental setting with the symptoms of hypersensitivity, causative or predisposing factor should be first identified by the practitioner. After taking a thorough history, and then a treatment plan should be designed accordingly to treat the hypersensitivity. Thank you.